Hello, and welcome back to our Store on Planet podcast with me, your host, Jack Cole. So today I'm joined by Laurent Locquet and Alex Semjonov. So both of you, welcome, thank you. And jump in with Laurent. Tell us a little bit about your background, what it is that you do, and we'll go from there.
Yeah, thank you very much for the invitation. I'm originally from Belgium. I graduated in the University of Ghent. Then I did an internship in the UK. Then I did a residency in veterinary cardiology in the University of Ghent again. And during my residency, which is a specialty training, I got involved in cardiovascular research in non-domestic species. And after finishing my residency training, I came back to the UK. And basically now my daily job is as a veterinary cardiologist in small animals, namely cats and dogs. And occasionally, or quite frequently, I'm involved in cardiac screening and research in non-domestic species still.
Yeah, and Alex?
Hello, everyone. And I'm originally from Estonia, and I lived the whole of my life in Estonia as well. I was graduated. Then I started my specialization, and my field of expertise is anesthesiology. So I did my PhD at Estonian University of Life Sciences, but all experimental work was with non-domestic animals, and that's how I got involved to zoo and wildlife medicine. Currently, I'm the chief clinical officer at the head vet of the zoo, local zoo as well. So I do lots of research and lots of teaching and practical clinical work as an anaesthetist with different species of wildlife, including like the free-ranging zoo animals and marine mammals as well. Although I need to commit that I still work as a small animal anesthesiologist, but involved to zoo and wildlife, providing the service for the long-term anesthesias, pretty much in any animals, including giraffes, rhinos, big carnivores, elephants, so on.
Incredible. Thank you to both of you. Okay, so for our audience who, like myself, are quite sort of quite regular people who don't know much about the field, Laurent, starting with you, could you tell us sort of exactly what it is that you do day to day?
Yeah, so on a daily basis, I scan, treat, and manage dogs and cats with cardiac disease. Sometimes we are able to repair certain cardiac diseases as well. For example, some heart diseases, which we call congenital heart diseases, and were diagnosed shortly or quite soon after birth. We can do that through keyhole surgery, and then I'm involved as well in an open heart surgery program in dogs in a private center in the UK, close to Cambridge. And then apart from my daily job, I do cardiovascular research in non-domestic species, so primarily big cats, but some great apes as well. So for example, great apes are predisposed for certain heart diseases, and more zoos are becoming aware of the importance of cardiac screening in these species. So I'm part of a group that is dedicated to screening great apes in zoological institutions in Europe as well.
And Alex?
So I pretty much can just say the same, that on a daily basis, I work as a small animal anesthesiologist. So my main patients are dogs and cats with difficult or different problems mostly. Might be long dental procedures or some surgeries, or any other case like visual diagnostics, or any case actually where they need to have an anesthetist there. And one day in the week, the animals there, mostly again like doing anesthesias or bigger procedures. But I travel a lot. I do clinical services for anesthesia for different occasions, different reasons, in not domestic species, like as I said before. the range is quite wide. So might be the rhino was wound in one zoo, then I fly to another place because of giraffe dental trimming or hoof trimming, then also like marine mammals, because there are not so many anesthetists in Europe available that can do marine mammal anesthesia, and we do lots of dental work on all kinds of species of animals. And I do lots of training for zoo vets, wildlife vets. I just came a few days ago. I came from India, was teaching their people that try to solve the human-animal conflict, because we all understand that the population of people on our planet is too high, and anyway, we live in the planet together with other wild animals, and it can produce some tensions between. So I do these kind of things with tigers, leopards, elephants.
So Alex, just keeping with you for a second, sort of a bit of a naive question, but what are some of the challenges that come with anesthetizing animals as opposed to people, apart from the obvious? Yeah, go ahead.
Well, you have, in this case, if you have the conflict between the animal and the people usually prefer the easiest solution, just to shoot the animal, right?
Right.
So we teach them how to avoid that, how to translocate animals. So how to, for example, use radio collars for them to give the early warning signals to villages that the animal approaches them.
Right, and Laurent, similar question. What are some of the challenges as opposed to dealing with people?
Yeah, so when it comes to people, obviously you can tell them how to lay down and hold their breath, which is quite challenging with the average Chihuahua. But usually you follow a dedicated protocol. There are some guidelines that you can follow to scan domestic species, for example, cats and dogs and even horses. But when it comes to non-domestic species, then there are not many guidelines out there apart from a few species. And in some of these species, you have to adjust or adapt the cat or dog protocol. Let's say a big tiger, a tiger you can scan as a cat. And great apes, you have to use a human echocardiographic protocol. That would be bonobos and chimpanzees. For example, orangutans are even a bit more challenging because they have big air sacs. So that can be quite challenging because it interferes with your contact between your probe and the actual heart. And then when it comes to other species, for example, I've scanned bears, I've scanned other species as well, very, very tiny primates. Then you have to just hit and miss. And the more you do, the more experienced you become. And you sometimes have to be very original. And sometimes you find the heart back in a very strange place that you weren't expecting it. But it's a fascinating field.
And both of you, of course, travel quite a lot. And I was wondering, Alex, you mentioned India. So traveling around, and I'm sure both of you involved in lecturing and research, as I understand it. And Alex, tell me some of the things that are at the sort of the front line, the cutting edge of that research. That you've been working on.
Well, the main field of my research is to find a novel, more safe protocols for anesthesia for non-domestic species, because we know that anesthesia can create a risk for the patient, and all the time we try to improve something, because previously, like years and years, people used the same protocols, but nowadays we have possibility to create something new, to manage animals better in anesthesia. So, and of course, like a different species that, as Laurent just say, that sometimes you just use the protocol that can be used for domestic animals, but actually the tiger is still not a big cat, it's a tiger. So we try to find the safest possibility to anesthetize these animals and manage them in anesthesia for longer procedures.
And Laurent?
Yes, so basically, I'm sorry, I was distracted for a second. Can you repeat the question for once?
No problem at all. So yeah, I was just asking about, you're both on the sort of cutting edge of research, and you've given lots of lectures, and I was just wondering what's sort of in vogue in your field at the moment.
Exactly. Sorry, I have the attention span of a Labrador puppy sometimes. So basically, what we're looking at, for example, at the great apes, is we do know that in captivity, the vast majority of great apes succumb from cardiac disease. So it becomes more and more apparent that there's a difference between great apes in captivity and then their non-captive counterparts. And it's actually a two-way street. So, for example, when you treat or when you scan animals in captivity, then you can benefit and help with the management of that particular animal in that particular zoo. And you can extrapolate that knowledge to the non-captive counterparts and hope to help to understand better why some zoos or well, some animals in zoos succumb from certain diseases that are not prevalent at all in the wild. So that's the first group of research. The second group of research is, for example, cardiorenal research, so the connection between kidney disease and heart disease in big cats that we're doing with a good friend of both Alex and I, because, for example, 1 in 8, 1 in 7 domestic cats will get some cardiac disease at some point, and we know older domestic cats are, for example, predisposed as well for renal disease, kidney disease, and thyroid disease, and that doesn't seem the case at all, that there's a lot of cardiac disease and thyroid disease, but there is a lot of kidney disease in big cats. And again, it helps us to understand the individual animal better, help to treat the individual animal in the zoo, and hopefully extrapolate some of that knowledge to other species, even domestic species, for example, cats and dogs. And the third group in general is species that haven't been investigated that much. But for example, we do know that some endangered species anecdotally might succumb from certain diseases, and it would be helpful if you have at least a bit of a database in some of these species to compare with later on if we notice that certain species are sensitive for certain diseases for conservation purposes, for example.
And Laurent, could you speak a little bit more to that, the difference between sort of diseases you'd find between domestic animals? I mean, you mentioned a few there, but generally speaking, is it like a lifestyle issue that I'm imagining if something's captive, then it's going to be less active, I suppose? Yeah.
Exactly. So, for example, the best studied group in that aspect for cardiovascular disease would be the great apes, which are of course the chimpanzees, the bonobos, the gorillas, and the orangutans. And we do know, for example, based on certain papers, that up to 77% of chimpanzees in zoos die because of cardiovascular disease. But there are some very good studies out there, and for example, chimpanzees that are not kept in zoos. That they did further research, and they seem to be far less sensitive for cardiac disease. So we have to look for human-influenced factors that might contribute or cause cardiovascular disease in chimps, for example, and in zoos. So you have to think about the enclosures, you have to think about diet, you have to think about genetics. So those are things that if you invest more time, effort, and money in that kind of research, then you don't not only help the individual animals in zoos, but you would help to contribute to conservation as well, because it's a two-way street.
And Laurent, how has your field changed over whatever time span you feel is appropriate, perhaps over the last 10 years? Or when did it? Also, I'd like to know, when did it actually start becoming a thing? That there were people conducting this sort of procedures on species.
So I've been involved in wildlife cardiac screening and research for 4 or 5 years, and even within that fairly short time span, I've noticed that, in my opinion, a lot of zoo vets are becoming more and more open for collaboration. They see the purpose and the added value of having people with a different field of expertise, because obviously these are very skilled and knowledgeable vets, and they know 1,000 things about 1,000 species, but they are not. It's humanly impossible to do everything yourself as well. So more and more zoo vets are open for collaboration with other vets with another certain expertise. So that's very, very helpful. When it comes to the great ape cardiology, that has been quite obvious already for, let's say, 2 decades, that cardiovascular disease is very, very important. But you see the importance of cardiovascular disease and other types of organ failure and organ diseases in all different species becoming more apparent. So it's quite intriguing and interesting to see that more things become more obvious the more research we do in these species, in different species.
Of course, Alex, same question for you. Have you seen your field change, and how has it been developing over the past years?
Well, I'm in this field for 30 years now, and I think like the most important thing that changed is the more and more thinking about welfare of the patient, not just putting them sleep, waking them up, not thinking about how they feel during the anesthesia, during the procedure, after the procedure, what is the pain management after the procedure, and what animal feels after. So we put more and more attention to these kind of things to make the all cases of anesthesia safer for the animal. For example, if previously many colleagues, they said like it's safe to keep the animal in anesthesia for 20-30 minutes, but now we can do the procedures on difficult species like a walrus for 3-4 hours to remove tusks for them, and to make the animal not suffer from the disease that maybe this animal lived with for a couple of years. And we try to decrease the risks for anesthesia, and that's the main change at the moment, the management and welfare and pain management.
Brilliant. And I'm sure both of you have some stories about certain situations that you've been in. So Laurent, starting with you, tell us about some of your experiences that you've had at work. Stand out.
Yeah, so when I think about the extremes of the spectrum, for example, if I think about one of the largest animals that I've scanned so far would be a baby rhino of 400 or 500 kilograms that was conscious and standing. That was quite interesting because that has never been described before, and we managed to find the heart with the ultrasound, so that was quite cool. Then, for example, at a certain point, I was contacted for a polar bear, one of the largest ones in Europe, 600 kilograms in a zoo in France with respiratory distress, and they wanted to exclude cardiac disease. So it was quite scary to go there, to go all the way there and maybe not being able to find the heart, but we managed to find the heart with the ultrasound, and the heart was luckily fine as well. We flushed the windpipe, the trachea, and the lungs, and it turned out to be a bacterial pneumonia, and then we treated the bear, and he recovered fine. Then other extremes of the spectrum, for example, is the trip that Alex and I made recently to Borneo, so to the other side of the world. And we were involved in training local vets and helping them out with some tricky procedures, together with a mutual friend who did the dentistry and the dental procedures in the orangutan and sun bears. So yeah, we're very lucky to be involved in a lot of cool things at the moment.
And Alex, same to you.
Well, I think that because I'm doing anesthesia for many years and for many species of animals, but if you will ask for a story, I think one of the most emotional story with anesthesia was in South Africa in one of the private parks that had the rhinos, and I think it was 3 years ago when it was just before Corona, when it was really dry and was no water everywhere. And we got a phone call that there is the white rhino cow that's stuck in the mud. So, and she had a baby as well. So we came to the place. It was the river full of mud, the dry river. And because like that was the last chance probably for this female to find the water, she went into the mud and she stuck. She actually went on 2/3 of the body into the mud. So, but the worst thing was that she was struggling to get out from that, and she had a baby that was really a small one, and the baby was like just circling around, trying to calling the mother, and we needed to anesthetize both baby and the female, and we literally spent 2 hours of digging anesthetized rhino from the mud. We needed to pull it out from the mud, but because like the animal was struggling for 2 days to get from that problem, we thought, and we were quite sure that this animal already have problem with muscles and would not be able to stand up afterwards. So once we finally got it out, we brought the baby close to her. We recovered both of them, and we thought that if she won't be able to stand, then we'll just take the baby away and we'll feed that from a bottle in the rehab center. And I gave that 20 minutes. If in 20 minutes she will stand up, then we can do something. If not, then probably the animal should be euthanized, just when we think about welfare. And she struggled to stand up, and she stood up exactly in 20 minutes. All of our team standing there, we all were crying.
Incredible! Wow. Goodness. Okay, and so Laurent, back to you. What are some of the trends that you can see in your field, and how could things be developing, and what could we see in the coming years ahead?
Yes, so luckily more and more zoos are open for collaboration, so that's great, like I mentioned before. But for example, recently we organized a course on wildlife ultrasonography, so both to scan the abdomen, the belly, and the heart, and invited vets from all over the world to come and join us if they were interested. And it was very nice to see that the course was fully booked, was a good success or a great success, and therefore we're gonna try to repeat it soon and organize a second edition. So that just goes to show that many more vets are open to learn, even if it's with techniques that they're less familiar with, and that people with different fields of expertise are willing to collaborate as well. So the whole veterinary community is getting more and more involved in zoo and wildlife medicine and conservation. So I really hope that this trend will continue and that we'll be able to help many more animals and hopefully contribute a little bit to conservation of some very endangered species as well.
Absolutely. Alex, same to you. Tell me about some of the trends that you can see or what you'd like to see.
Well, I would actually say the same, because now we just want to train more people to keep the same standards of pain management, of safety of anesthesia, of welfare of the patient during anesthesia, to have possibility in different parts of the world to do that on a more safer way, to not put additional risk for the patient, for the animal. And I really hope that, and I see that people want to learn, and at the moment I think we just want to improve their techniques, their knowledge, and actually their ethical approach to the animal.
And Alex, for those who'd like to learn more and just understand your work, follow what you're up to, where could they find you? All those materials.
Well, when they can find me, they can Google my name and they will find the contacts for sure. But they definitely can find me in Estonia sometimes.
And what about resources? As you said, there's groups out there who'd like to learn more about your field or get involved themselves.
Well, on my Instagram page, I do lots of educational posts about the wildlife anesthesia. So it's Alex VetMed. So just join there, and you will get lots of information about different species of animals.
Brilliant, thank you. And Laurent, yeah, just to finish, same question to you. Where can people follow you, understand more about your work, or find resources if they'd like to, get involved themselves?
Yeah, to be honest, I'm not the most active person on any social medium apart from LinkedIn. I don't have any other social media apart from LinkedIn. And that's the medium that I use to keep people posted about cool stuff, about courses that we're organizing, to keep in touch or to get in touch with like-minded people. So if you want to discuss anything, or Alex and I can help you out with anything, just feel free to reach out and send us a message. And we're more than happy to help.
So Laurent, Alex, thank you both for your time.
No worries.
Thank you so much.